Well, good morning, teammates, community, families, friends of the 10th Mountain Division and the Fort Drum Community Garrison Partners. I am Colonel Christina Buckner, and this is
Command Sergeant Major Frederick Gibbons.
And we are the Mountain Medics. Mountain Medics 6 and 7. So we're rebranding ourselves a little bit, so you'll see our t-shirts coming to a workout station near you. So we thank you very much to our Garrison partners who are helping us do this video today to communicate with the community on some medical challenges that have been expressed by the community to us. And we wanted to take the time to tell you what's going on behind the scenes to resolve some of the challenges. Today in this video, we'll talk about our patient appointment lines. I know our phone lines have been a very big challenge. We'll talk about referrals to OBGYN and what's going on with patient care in our OBGYN clinic that's located at Samaritan. We'll also talk a little bit about what's going on with the pharmacy. And then lastly, we'll talk a little bit about medical referrals and the Humana versus Martin's Point information piece.
Hey teammates, so we understand our appointment line continues to be a concern, and the commander and I hear all of your concerns. So we want to talk to you about a couple of things. We're currently in the process of getting a voicemail for our call center, as well as by the end of the week, you will have access to the Genesis patient portal to make your appointments. So 1 March, we're supposed to be back online, okay? But with that being said, we have 2 numbers for you because we understand that our primary care clinic are our most frequent calls for appointments. So please prepare to copy. Those numbers are 315-772-1071, as well as 315-772-5136. These lines will also have voicemails attached to them, so we ask that you do leave a message if you get the voicemail, and our receptionist will return your call as soon as possible.
And also, just don't forget, if you have not registered on the MHS Genesis portal, please go on and register, open up your account, and from that portal, you're able to see your patient record, upcoming appointments, referrals that have been processed, past patient records, as well as have the ability to schedule appointments. We understand that the call volume has really degraded our ability to receive all of the multitude of calls. It's dropped calls, but I will assure you that our IMD team, our information management division, they are working very hard to rectify the situation with the local installation NEC and other partners to make the experience better for our patients. So thank you very much, Battle Buddy, for that. Okay, from there we'll transition to OBGYN. So I would say in the month of December, November-December timeframe, we put out a message on our Fort Drum Guthrie clinic page, as well as the Garrison page, that we were facing a decrement or a degradation of OBGYN providers. This is happening across the Army at many installations, and we, the medical community, are working to adjust our schedules and our operations based on the loss of staff. We have since received providers from the Air Force, or will receive providers from the Air Force eventually, temporarily, as well as other local hires to fill some of the gaps that we're experiencing. However, until then, we will continue to provide outpatient services at OBGYN at Samaritan from here forward. So what does that mean for our patients? From the time that you find out that you're pregnant, you will be referred to the OBGYN clinic at Samaritan. They will enroll you as a patient and manage all of your outpatient services. That's your screening, your prenatal checks, and will manage you up until a certain point between 28 and 32 weeks. and then refer you from there for delivery to the community. So the use of our community is that we're heavily integrated with our civilian partners, Carthage and Samaritan, who are right now helping us with our staff shortfalls by managing labor and delivery while we're managing the outpatient services. So we assure you that we're doing a warm handoff of the patient to the network, and that your care will be managed throughout your pregnancy. If you have any issues or concerns, always call the OBGYN clinic at Samaritan. If you have already been referred to a facility off close, please maintain and manage your care there until your birth. Post the birth, you will circle back, and your child, as well as you, will be provided care at the Guthrie Army Community Health Clinic. So that is all right now with OBGYN, and we will put out more information as our new providers are onboarded and we increase our staff levels in the OBGYN clinic at Samaritan. Val?
So now we'll transition to our pharmacy concerns. So if you follow us on social media, you will know that since the last week or so, we've had interruption in our pharmacy services. But however, just so you know, rest assured, it's all DOD pharmacies that were affected by unplanned network interruption. However, we are filling 90% of our prescriptions currently. The ones that we are not unable to fill are the ones that are restricted by authorization or the quantity has limitations. We will continue to work the concern, and we'll continue to message to our social media page so that you understand what's happening as we receive it. Thank you for your understanding and patience as we continue to work through these concerns.
Referrals has been a challenge, and we're realizing it's just a lack of communication and education to our beneficiaries to understand how to navigate the referrals process. So I will read this so that everybody is very clear on how the referrals process works from the provider to my managed care division through Humana to the community to get you your continued care. So routine referrals are processed within 72 hours of being placed by your provider. This is military service members and also our civilian patients that are seen here at Guthrie. Once a patient is accepted by an internal specialty clinic, the support staff will call to schedule an appointment. So I will tell you this as a rule of thumb: if 72 hours has passed after your provider has stated that they've put in a referral, it's okay to call and check on the status of your referral. You can also see that in the MHS Genesis online patient portal that your referral has been processed. If the patient is sent to the network for care, our team within managed care will review the authorization to ensure that they are assigned appropriately to the right clinic, and then send the patient's record forward to that clinic. Most network providers will reach out to the patient directly to establish the care. I've experienced that, and here in the North Country, they're very consistent with reaching out to the patient once care has been established. If the patient does not hear from the network within 7 to 10 days, please, after seeing the primary care provider, patients can call 315-772-4335 or Humana Military at 1-800-444-5445 for assistance. TRICARE Prime, and this is for the TRICARE Prime beneficiaries. All active duty service members must enroll in TRICARE Prime. It is optional for other beneficiary categories. Beneficiaries receive most care from assigned PCMs at the MTF, which is our medical treatment facility, Guthrie, who refer beneficiaries to specialists for care as needed. So correction, it's not just here at Guthrie. A lot of the division soldiers are seen at Bow, Connor, and Falcon TMCs. So please call or go to your assigned facility to receive care. Families are seen here. Civilian beneficiaries are seen here at Guthrie. U.S. Family Health Plan. Let's talk about this. There's some confusion between Humana Military and Martins Point. So Humana, all active duty service members must enroll in TRICARE Prime. However, all other beneficiary categories can decide which other insurance plan they want to choose. And some choose Martins Point. However, those that receive Martins Point cannot receive care here at Guthrie or within the Soldier Health Services clinics, which are Connor, Bow, and Falcon clinics. They can come to the pharmacy but have to pay a copay for pharmaceuticals. Most of their care is provided solely by the network. So U.S. Family Health Plan, Martins Point is what it's called. Active duty service members cannot enroll in Martins Point. It is open to all other beneficiary categories, but all care is provided by a designated Martins Point primary care physician or specialist. Beneficiaries cannot access care from military hospitals or clinics and TRICARE authorized providers or Medicare providers. So please be mindful when you enroll in these systems that the military healthcare system cannot support you if you are enrolled in Martins Point. You will receive all care within the network, Watertown, your primary care, and wherever they refer you in the greater upstate New York. For those that are enrolled in TRICARE Prime via Humana or other TRICARE Select via Humana can and will be seen here at Guthrie in its outlying clinics. So with that said, team, this is just a preparatory email before our town hall that we're going to do on 3 April. I think the times now are between 10 and 11:30 in conjunction with the community information engagement. More to follow on that as we announce that. We will go live with myself and my battle buddy here, as well as some other key members in the medical team to highlight these things in more detail, some of the topics that we've discussed today, as well as other topics that we think the community should know, and also answer the most frequently asked questions that we see. So we hope that you guys can take the time on 3 April to come to the town hall and listen to all of the good conversation that the medical team is going to share. And please, if you have any questions, just leave your questions below this video so we can get the answer and be ready to present you that answer on 3 April. So again, we appreciate you. We're dedicated and committed to care within this community. And if you ever need anything, please come see us at Guthrie. Our patient advocate, Ms. Deb Woods, is the best and is always available to all of you. Battle?
We look forward to seeing you on 3 April. Mountain Medics out.
Care for the climb.